Hello, good evening. How are you? Yes, I know you can hear me, Abby. Now the time is 7:32 p.m. Today is the 16th of October. How far now? How are you? I just say my come online this evening so that I go fit take one or two questions because I notice say a lot of people, a lot of people won't ask me questions. You understand? So now say I just come online and see if I feel respond to one or two questions like that. Sure you understand like that. Yeah, let me see if I can respond. So where are you watching me from? How your side? How you day? Hmm? If you can see me, tell me where are you watching me from? Oh yeah, let's go. Talk to me. Okay. If you are seeing me for the first time, my name is Dr. Frederick Unubohai, and I'm a licensed medical doctor. I teach, I educate people. But this evening, I just decided to come online so that I go fit answer one or two questions. So if you dey watch me right now and you can hear me, just drop in the comment section. Tell me where you dey watch me from. Who dey here? Who be this? Chuku Chukwuka Emmanuel. Hey, Chukwuka Emmanuel, how far now? I see you. Okay, you're watching from Kenya. Oh yeah, now. How is Kenya? How that side? How that side? How you be? Talk to me. How you be? So that I go fit me. Where you dey watch me from? Who dey here? This thing they make one kind sound, but I will try fix the sound, sure. Okay, if you can hear me, tell me where you dey watch me from. Let's go. The sound for this thing, chai. Now, wow. I'm still trying to work out the sound so that I make it fix. No vex abeg. Okay. Now, if you get questions for me, ask me. I want answer a few comments. I want a few comments before I end this evening. So how is Kenya? Chukwuka Emmanuel. How Kenya be? How you day? How you day? Tell me. How Kenya day? Let's see. I'm trying to pick up something. I don't see I'm here. Okay. Yeah, so do I have another comment here? Kenya is good. If they ask you, you go say go meet your doctor. Yes, don't ask me for treatment now. Don't ask me for treatment here. If you ask me for treatment, I'm not go give you treatment. Do you understand? Eh, because some people go come internet. Thank God say you don't bring this comment. Thank you, Jessica. So a lot of people come social media wanting you to treat them, make you prescribe medicine for them. No, that one na nonsense now. I can't treat you on Facebook. Eh? You don't want somebody that will scatter your body. Somebody cannot come and be telling me, doctor, my what now? I cannot urinate. Which medicine should I take? On top Facebook, how? You have to go to the hospital. But if there is anything that is not clear to you, you won't ask. Sure, that one I go explain. But if you dey find medicine on top this place, make I treat you on Facebook. How bad now? How? I can't do that. You will have to book a private consultation. You will book for that one. You will pay for private consultation. This live session is not a private consultation. Fumilayo, watching from Italy. Okay, you're watching me from YouTube. Yes. So thank you for dropping that comment, Jessica. Um, People want you to treat them online, not knowing that there is danger. There are dangers. Nobody can be treating you like that. Hmm? Yes. Yes, I can tell you to take paracetamol, vitamin C, and the rest. But if now medicine, maybe say you get problem, no, you go need to enter hospital. You go need to speak with your doctor so that make your doctor handle your case. Is that okay? Is that okay? Yes, 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 I see. Uh-huh. So I made a video. I don't do the video since a long time ago about this resource factor, A negative, O negative, and the other stuff. And I noticed that a lot of people don't know about them. So if you never watched the video where I drop concerning resource incompatibility, try try and watch it. Try and watch it. Yeah, man. Okay, let me see who and who they here. Three people are watching me on YouTube. People on YouTube, how far now? How far? How far? How far? Let's see. How far? Uh, yeah. So let me see. Which other? Okay, I'm watching from Freetown. Who be this? Michael. Michael is watching from Freetown. Michael Kanu. How is Freetown now? Hmm? This night na gisting night. Not be say na gisting night be this. You get the point. Yes. Okay. Barry. Barry says good day. Barry, how far now? How your matter be? Yes, yes. Do I have so for anybody where they try say I want to call you, I want to private chat you, say that one it no go dey possible. It no go dey possible. That is why I dey try to come here and clarify one or two things for you. But if you dey find medicine, maybe you want make I treat you, make I tell you, maybe you say, doctor, I have hypertension, which medicine can I buy? No now. No, that one cannot work. Let me see. I think I have a comment here from LA. Good evening. Jude. Jude, how far now? Jude Moore, I greet you. I like your videos, but it's my first time to comment. No problem, no problem. Thank you so much. You can be commenting. Oh, see, they drop comments. Don't worry. Drop comments. They drop comments. You understand? Yes. Thank you so much. Okay. Jude say a day. I see you, Jude. Joy is watching me here. For all the people where does they follow my page, you do welcome. You do welcome. I just try ma come online this evening. Maybe we just chat one or two. Sure you get. You can ask me anything, even if it is not medical. See, ask me, no fear. Ask me, ask me. Joy, how are you? I did. Oh yeah, now I greet you. Yep. Okay. Let's see. Do we have any more comments? Sarah. Sarah is watching from Freetown. That's Sierra Leone, Abby. Uh-huh. Sarah L. Durin. Okay. The remaining people where they watch, guess what? Guess what? Now after I don't come end the live session, you come dey see comments, see questions. That time I don't come out. Uh-huh. So use this opportunity now and ask. Let me see. I think I have some comments here. Let me see. Good evening. Hey, Felix. Good evening. Who be this? Gazama. Gazama, I see you. Okay, good evening. Clarkson. Clarkson, good evening. Felix. Felix, good evening. Oh yeah, now. No other comment. I hope I'm not missing people's question, oh, because this thing they do my eye one kind. I hope I'm not missing anybody's comment here. I hope I'm not missing anybody's question here. Okay, no, I'm not missing. Nice one. Okay, the 20 something people where they see me right now. How far? Okay, let me see. Somebody drop comments on my. Let me see. 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 Okay. Okay. Let me see if I have a comment here. I'm going to go back and check that one later. Hi. Ah, Karen Adamadu. I greet you. Mamfe. So this evening, na free day, oh, na open day, oh. If you know you get something wey you wan ask me right now. But please, don't ask me to treat you on Facebook or on YouTube. I can't treat you here. But anything wey dey your mind wey you wan clarify, use this opportunity. But if you no wan ask and you want us to gossip and gist, well, no problem. I go follow you gossip. I go follow you gist. Is it true breast cancer starts from the neck with goiter? No, God forbid now. Eh? No. Breast cancer starts from the breast. Goiter is totally different from the breast. So I don't know. I don't know where you got that from. Mamfe. Mamfe Ate. Yes, thank you for asking me. So let's interact. Drop in the comment section. Where did you get that from? Breast cancer does not start from the neck. Breast cancer starts from the breast. Whenever you hear the word cancer, cancer of the liver, meaning that liver cancer is starting from the liver, or you get prostate cancer, cervical cancer. Now, there's what we call metastatic cancer, meaning that the cancer has started from one place but has spread to other parts of the body. So somebody can have prostate cancer, and those cancer cells can spread to the lungs, can spread to the liver, can spread to the bone. You understand? So the primary cancer is the place it's starting from. So breast cancer starts from the breast and it can spread to other parts of the body. Eh? Yes. Okay. I always follow up your program. It's very educative. Thank you so much. Thank you very, very much. Thank you. I appreciate Sarah. Help me share this live session, so that more people can come and learn. I don't understand my body. Oh. Every day I must take medicine to sleep well. This is disaster. This is problem. You are looking for problem in the nearest future. Me and you, I can bet with you that this medicine you are taking, a medical doctor did not prescribe it for you. Abi, you are the one taking medicine to sleep. Now listen carefully, because Jessica said something, and I have to explain again. If you cannot sleep, there are many reasons why people can't sleep. If you don't know the reason why you are not sleeping and you are taking medications to sleep, what you are doing is that you are getting your body addicted to that medicine. One day, it will never work for you again. Number two, you will never be able to sleep without taking medicine. This is why you have to speak with your doctor. Because as I'm talking to you right now, I don't know you. I don't know anything about your problem. I don't know anything about your condition, about your work life, your family life, your drug history. This is why we always tell people to speak with their doctor. If not, this thing will disturb you in the nearest future. I don't even know how old you are. You understand? So there is a huge problem waiting for you at the nearest future. I'm going to advise you here. I don't even know the medication you are taking. I'm going to advise you, as soon as possible, make plans to go and see your doctor so that they might be able to stop the medication for you and find a lasting solution. Problem though, Abi? uh Hope you understand. Clarkson, you understand, right? Somebody says, who is this? Please, can you help me with an assignment? I should help you with an assignment. Stella Emmanuel, I should help you with an assignment. I don't understand what you mean. How can I help you here? You can drop the comment here. If I can, I will respond. If it's something that you want me to respond here right now, please drop it here. Good evening, Mr. Chudon. Mr. Chudon, how far now? How you there? How you there? How you there? Okay. Let me see. Is there any other comments? I hope I'm not missing any comment here. Okay. Salauddin Rofiat. Salauddin Rofiat. Good evening. How are you? Uh-uh. Aurea Peace. Peace, how far now? How you there? Hmm? Okay. For those people wey just dey come my live session, abeg, I dey always tell people, social media no be hospital. Social media na to teach you, na to explain to you so that you go understand. There are few medications you can take from the internet, very few of them, very few, very, very few. Medications, maybe analgesics, even at that, you have to be careful. Maybe multivitamins, maybe supplements, few of them. Other than that, you have to speak with your doctor so that you don't mess up your body system. Hmm? I dey fine. Mr. Jude says, good evening. Why am I having back pain always? Ha. Why are you having back pain always? My guy, it can be your name, Mr. Jude. You won't make with a guess with your body online. Because somebody, you want me to tell you that the reason you are having back pain is because of your job. But I don't know what job you're doing. There are many things that can make you have back pain, Mr. Man. Plenty things. Plenty. Plenty things can make you have back pain. So for you, your own cause, I don't know. You understand? But back pain can be caused by work, poor posture, your age, accidents, problem with your bone, your spine, problem with organs that are or the tissues that are around that area, pelvic problems, you understand, a mass, infective processes. So if somebody say I dey get back pain, why? You cannot just start guessing. You have to know many things. When the back pain starts, how the back pain be, wetin be your age, which kind of work you dey do, which time the back pain dey come. The back pain, e dey affect your leg, e dey affect you when you dey waka, too many things. This is why I dey always tell people say it's important you discuss with your doctor one on one, shey you get, so that we go fit know many things, and then if there is any test for you to do, they go tell you the kind of test. But for here, there is no test I can tell you because I don't even know what might be the cause of your back pain. Hmm? Okay, I have plenty questions. Let me see. Good evening. Good evening. Good evening, patients. Immaculate says you are doing a good job. Thank you. Who be this again? Let me see. Oh God, I think I need to get a mouse. What is the cause of hepatitis B and the remedy? I don't do plenty video about hepatitis. Plenty videos. I noticed that people go just come my page, then no go watch videos. They know they watch videos. So hepatitis B is caused by hepatitis B virus. Now viral infection. Viral infection. And it can be spread through different means. Can be spread through intercourse, can be spread through sharp, sharp objects. Hepatitis B virus is more effective than HIV virus. HIV. What is the remedy? Remedy is number one, get tested. Number two, to confirm the viral load. Number three, to confirm it if it has affected the liver. If the viral load is quite high, they will place you on antiviral agents. If it has affected the liver, to what extent? If it hasn't affected the liver, fine. Then we will advise you avoid certain types of lifestyle, and then you should be good. So that is the whole management protocol. Okay, let me see. When on antibiotic, Is it advisable to take your blood pressure medicine along? Sure, you can. Fumilayo, yes, you can. You definitely can. Yes, you can. But please, I hope you're not taking antibiotics prescribed by yourself. What be this? Says, is breast cancer or cancer in general hereditary? What be this? Mamfe. So this day before yesterday, that was on Sunday. No, not day before yesterday. Day before yesterday was Monday. 3 days ago on Sunday, we spoke about breast cancer. Breast cancer is one of the plenty type of cancers. There are some cancers that are not hereditary, and there are cancers that are hereditary. There are cancers that are tied to your lifestyle. Do you understand? Now, among the things that can make somebody develop breast cancer, there are plenty things that can make a woman come down with breast cancer. One of them is that if somebody in your family has had breast cancer in the past, maybe your mother, your sister, your aunt, or any relation in the family, you are at risk of coming down with breast cancer. You are that does not mean that you will surely come down with breast cancer. Do you understand? So um, there are other types of cancers too that can be hereditary, such as ovarian cancer, such as colorectal cancer. So if you have somebody in the family with any of these cancers, it simply means that you should be more attentive to your health. Do you understand? Yeah. I am in Kuwait. I go to hospital, but they always give me Panadol. Panadol for what? For your back pain. Tell them to carry out tests. Tell them to carry out tests for you for your back pain, so that they should be sure of what's happening. Eh? How can I talk to you one on one? You would book for consultation. No. If you want to speak with me one on one, you will book for consultation. Um, my email is on the page. Let me see if I can post my email. My email is on the page. You can send an email requesting for a consultation. My admin will respond to you, tell you the amounts and other stuff that you need to do. Do you understand? Let me see if I can paste my email on the screen for you. Um, Let me see if I can paste my email on the screen for you to see here. Okay, here is it. So send an email. My admin will respond and tell you the process and everything you need to know and the amount. Yeah, that is how to talk to me when you speak with me one on one. Yeah. Let me see. Mr. Jude says, I do drive much though, both chests. I don't understand. So I'm not 100% sure. You understand? Because we are not consulting. So I'm not making a diagnosis for you here. But maybe you're driving, that drive that you're driving, that motorway they drive, the kind of job you do, maybe you drive for a very long distance. It might be one major cause of your back pain. You understand? Yeah. Oh yeah, share the live session. Share. Let's see. Doctor, what can be the cause? I am a lover of sports, but each time I make sports or lift heavy weight, I feel these pains on my testes. And this is actually not a good sign, Mr. Felix. This is actually not a good sign. I think you should get it checked. No, it's not a good sign. You shouldn't be feeling pains in your testes. You understand? Or what you can do is reduce the intensity of whatever activity you are engaging in. But most importantly, if you engage in sports and you feel testicular pain, it's not a good sign. Huh? You need to be examined. You understand? Yeah, it's not a good sign at all, at all. Okay, let me see. Let me see. Do I have? Let me see. Let me see. Let me see if I have more comments here. What is the cause of chest pain? Because the person has gone to hospital and they told him it was as a result of weightlifting. So well, I don't know if the person did any tests. You understand? I don't know if the person did any tests, um, but they will have to do some tests. Okay, okay, yeah. So they have to do some tests for him. I don't know what test they did for the chest, Mr. Chudon. I don't know the type of test they did for the person's chest. Maybe they did an X-ray. I don't know. I don't know the extent of the chest pain. But if it's because of heavy weight lifting, I think the person will need to stop that activity for a while, and then um, and observe and see if it will resolve. You understand? Yes. Okay, oh, let me see if I have more questions before I disappear. Let me see. Why do I always feel pain on my feet? Plenty things now. What be on a blessing Monday? Plenty things can make you feel pain in your feet now. Plenty things, plenty. But I don't know your problem, oh. Because people are on the internet looking for diagnosis. I'm not diagnosing you here, oh. So if you are feeling pain in your feet, maybe you are standing for too long. Maybe you have accident in your feet. Maybe you use your body weight. You understand? Eh? Maybe you have what again can give you pain. Maybe you have issues with nerve around that your feet area. So if you're having pain in your feet, I will advise you, number one, it's a free advice. Rest your feet. Rest your feet. Rest. Take an analgesic to see if it disappear. But if it continues, then discuss with your doctor. Rest. Rest the feet, maybe to disappear. Take an analgesic. But if it continues, then you want to speak with your doctor so that they can find out, examine you, to know what. I've answered you. I've given you the advice. I've told you what to do. What is the cause of no heartbeat in pregnancy? That was what the scan says. That was what the scan says. Have you taken this scan result to the doctor, to your doctor? If there is no heartbeat, it means there is no heartbeat. The pregnancy is no more viable. I'm trying to be careful with my words. Hmm? I'm trying to be careful with my words, with what I talk. When you do pregnancy scan and they cannot pick the heartbeat, it means the pregnancy is not viable. I'm looking for the most polite word to say here. It means the pregnancy is no longer, let me use the word viable, leave it like that. I beg. Hmm? You understand? So, what can cause it? Sometimes it can be unknown. It can happen like that. You might not know why. You might not have any idea. Eh? Do you understand? You might not even know why the thing happened. Sometimes there might be other problem. Eh? Maybe the woman has a medical condition going on in her body. You understand? Or maybe it was lifestyle. But sometimes you might not be able to pick anything. No heartbeat has happened twice now. Um, when and where, and what did you do about it? The first one, what did you do? Second one, what did you do? Because this is no longer a good sign. It simply means now that there is something inside this woman that is causing this stuff. At what gestational age, how many weeks the pregnancy dey when you dey notice say no heartbeat? This is very deep and big. So if it happens the first time, happens the second time, At what gestational age and how many weeks in the pregnancy? What did you do after this thing happened? Did you go for any checkup to know? Or you can tell me. First time we thought it was stress. Okay. I have many questions here. I have many questions. But I'm responding to you now. Adeyemo Oluwaseun. So the second time. So what did you do? What did you do after this one? Because it is now obvious. It is now clear that something is causing this, meaning that this woman needs to be checked. Huh? This woman needs to be checked. You understand? Now, for I see a lot of questions here. Please, oh, I beg, let me give a disclaimer. Here is to advise people. Here is to counsel. Like, I'm not your doctor. You understand? I'm not your doctor. I don't know you. Please, eh? I'm not gonna come on here and talking rubbish and now put myself in trouble. No. So there are two options. You can speak with your doctor or you can book a private consultation. If you want to book for a private consultation, send an email. My admin will respond to you. You understand? Eh? I'm just here to just give you one or two advice, guide you. It's not as if I'm responsible for you. I beg. Okay, let's see. So Adeyemo, what did you do? There are so many questions here. Oh. Um, yes, they have done some tests with him, according to him. So they asked him it was as a result of that because they asked him if he was doing it before and he said yes, but he's doing it no more. So let him continue resting, should not do that anymore, and then go for regular checkup. Eh? Go for a regular checkup. And what type of test did he do? What type of test did they do for him? Um, let me see. Oh God. Let me see. God. See comments. Each time I complain, they will just give me painkillers, and I don't love taking painkillers. I don't understand your question again. Sorry, can't remember your question. I can't remember your question. No, no vex, no vex. I can't remember. Okay. Let me see. She did test. Which doctor did she see? Did she see a gynecologist? She did test. Which tests did she see? I'm sorry, which test did she do? And did she see a gynecologist? That is number one. Um, Number two, you did not tell me at what point was this no fetal heartbeat? What point in the pregnancy? And what advice did they give? What advice did they give? What advice again? Apart from the medication they prescribe, what else did they tell her to do? Tell me. Okay, so many questions, and my eyes are now hot. My eyes are hot. My eyes don't they pepper me. Like my eyes don't they pepper me. Don't they pepper me. Around 12 weeks. Okay. So do me a favor. I need to find out something from you. I want to be sure if you understand your treatment plan right now. So apart from the fertile gain that the gynecologist gave, what else did they tell you? This is extremely important. What else did they tell you? Around 12 weeks. So sorry, yeah? So sorry. So sorry. So what else did they explain to you? Tell me. Uh my eyes don't they prepare me. Okay. No, I'm not seeing comments. I'm not seeing your comments. Let me see. I hope. I hope I did. Let's see. Doctor, your telegram is not working. It's working now. Madam Edith. Edith. Which Edith is this? Your telegram is not working. It's working, no. It's still working. It's still working. What happened? Did you subscribe? So let me talk about the telegram. Let me talk about the telegram. It's working. So for anybody who wants to join my private community, you can subscribe. There's a link on my page. Look for the link. Subscribe and join. There are people there. When you subscribe and join my Telegram, it's not for consultation. It's not a platform for private chats. It's not a platform for private chat. It's a community. So I go live there. I can speak with you when you subscribe. Last month I subscribed, but I couldn't join. Okay. Send an email. Don't worry. Send an email this evening. Send an email. Just put your name again. Don't worry. Um, Tell my admin that I told you to send the mail again. Don't worry. We'll respond. And in that email, in that your mail, put your number. Put your number in that mail. Yeah, so that we'll look for a way to add you. Do you understand? I'm sorry. Sorry. Yeah. Pele. Sorry. 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 For anybody who wants to subscribe and join, there's a link on my page for subscription. No vex. I don't know why it happened, but send that mail, put your number, so that we will find you now on Telegram and add you. Hmm? Yeah, sorry. Okay, let's see. Let me see. I stopped breastfeeding since last year, and my breast is scratching me. What is the cause? And prescribe drugs for me? No, I will not prescribe drugs for you, madam. Omolola, I will not prescribe drugs for you here. No, never. Huh? Uh-uh. I don't do that here. Why is it scratching you? It might be scratching you not from your breast. I don't know if this your scratching. This your scratching is not related to your breastfeeding now. Are you telling me that the scratching has been there since 1 year, since last year, scratching you till now? Are you sure? If your breast is scratching you since last year till now, that one is a different ball game. However, if it is scratching you, you can. We have to be careful so that it's not a big problem that we are playing with here. If he's scratching you, if he's scratching you, well, I will advise you go to a pharmacy. Eh? We go to the pharmacy. Let them prescribe at least a cream for you to see if it will help you. But if you have used cream, different types of cream, and it's still scratching you, then enter hospital so that somebody can examine your breasts. Do you understand? Enter hospital, your breast will be examined. We'll see, find out all the creams you have taken to know what is going on. And if you need to do any tests, I will not prescribe any drug for you here. Never. I beg, no vex. Hmm? Okay. Let's see. Do I have any more question here? They said hormonal imbalance. Which hormone? Which hormone? Which hormone? Which hormone? Uh, what cause? What can cause someone menses to stop flowing and the person is not pregnant? Onyenyechi Alexander. Plenty things can stop a woman's period and the woman is not pregnant. Plenty. I have made a video about it. So let me just list some of them for you. Number one, when a woman is when a woman has entered menopause. Number two, when a woman is on certain medications. Number three, a woman that is severely stressed. Number four, I'm mentioning some, I'm not all of them. A woman with issues with hormone, woman that has problem with thyroid, woman that has problem with her weight, woman that has problem with maybe ovary. So there are many things that can happen to a woman, and she will not see her period. So many, plenty. This is why. Now I want you to do me a favor. Go and watch that video because I mentioned some advice for you there. If your period has stopped for 1 month, don't panic, relax. But if it has gone beyond 2 months, 3 months, then you have to go and see your doctor so that they can examine you and check what is going on with your system. But if it's just for the first time in your life, just 1 month, and relax, relax, relax. But if it has been happening to you repeatedly, there might be a problem going on. Let me see. My time on the live session is almost up. Uh, what test can someone do to detect cancer? Who be this? Joyce or Sarah say. So this your question is like you are asking me where where can somebody find Nigerians? Nigerians are everywhere in the world. Nigerians are everywhere in the world. So if you are saying where can somebody find Nigerians, your question is like do you want to travel around the whole world looking for Nigerians are everywhere. You understand? So if you say what test can one do, there are different types of cancers. If you are specific, you can say, okay, what type of test can someone do for colorectal cancer? Oh, a colonoscopy. You understand? To check. Oh, what test can someone do if they have breast cancer? It's different because your question is like you want to enter everywhere. It makes sense. I'll be clear for your eye. You understand? Okay. It's almost time to go. 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 Please, can clomid cause ovarian cyst? Who gave you clomid? Clomid can cause a lot of things. It can cause a lot of things. I noticed that some ladies take clomid by themselves on their own. Please, oh, if you are watching me and you have not shared, oh yeah, support me by sharing. Eh? Okay, okay, I'm coming. I beg. Uh, okay. Yeah, it's almost time to go. People are not sharing the live session. It's surprising that people go ask you question, ask you, but they want you to lie down, open cloth, beg, share, like. Ah, God have mercy. Can someone with low sperm count impregnate a lady? Sure, yes. Peter, Mr. Peter, no sir. Yes, it's possible. It's very possible. It's very possible. Let me see. It's time. It's almost time to go. It's almost time to go. It's almost time to go. Let's see. Let me see. Let me see if I did. Hope I did not miss comment here. Let me see. Um. Okay. Okay. So I don't try. Okay. So for breast cancer, um, depends on many factors. You understand? Many things. Depending on the age, depending on the symptoms. So you can't just walk and say, I want to test myself for breast cancer. For the lady that asked me about breast cancer, so let me just explain because October is breast cancer awareness month. Number one, you need to have seen your doctor so that they will examine you. First of all, okay, this is what we are seeing, this is what we are seeing, this is what we are seeing. Okay, this is your age. Oh, you are above 40, do a mammogram. Oh, you are less than 40, do an ultrasound scan. Oh, you have a lump. Okay, let us do a biopsy to see this lump, to study the lump. Eh? Let's take this lump for pathological analysis. So there are many things to know depending on the type of symptoms you are having with your breast. You understand? It's not enough to just go and say test me for breast cancer. There are things to examine first of all to see from the patient before you now go for tests. Eh? But normally, if you are above 40, you can go for a mammogram. If you're less than 40, go for ultrasound scan. But if you have a family history of breast cancer, then your case is special. Okay, I have to go. I don't try. I can't answer everybody. My eyes they pepper me right now. Uh, I hope you share the live session. Somebody's asking me about palpitation. There's a video on my page. What's your name, Mr. Chinedu? There's a video on my page on palpitation. Somebody's asking me about back pain. There's a video on my page on back pain. Please watch it. Watch it. Watch it. I've made a video on palpitation, or you can go to my YouTube. It's going to be easier for you to find the video there. Um, you understand? Please go to my YouTube. It's going to be easier for you to find. So I made videos on palpitation, back pain, period, weight gain, hypertension, and a lot of stuff. So please try and watch it. Thank you for joining. Thank you. I'm sorry if I couldn't respond to you. For the person asking for a one-on-one consultation, if you want to have a one-on-one consultation, you have to send an email, and then my admin will tell you the process. Do you understand? My email is, check the comment section. You will see my email there. Let me see if I can pin it one more time. Sorry. Let me see if I can send the email again. Let me see. Okay, so here is it. Here is the mail. Um, for anybody who wants to book a consultation. Hmm? Yeah, this is my email on your screen. Okay, thank you, everybody. Take care of yourself. Remember, like I always say, good life, good life, nonsense. Bye.